What Uber, Airbnb, and BenMaamer Institute have in common? The surgical freedom model they don't want you to know about. This is very close to my heart. If you are a surgeon who feels the system squeezing you, if you are looked at a hospital bill and wondered, where is all this money going? Because none of it is landing in your pocket. If you are tired of hospitals, insurance companies, and management groups treating you like the disposable part of healthcare, then keep watching. You won't regret it. Because what I built is the answer to that injustice, and they are not going to like it. Let me start with the why I built it. Because of the injustice. After years inside the system, I hit the point every surgeon eventually reaches. Enough. Hospitals charge whatever they want because they can. Insurance company underpay surgeon and call it cost containment. Management company take a big cut and don't take calls. Malpractice carrier punish solo surgeon. Corporate suits decide your value while never touching a scalpel. And the cherry on top, you know what it is? No transparency. That's huge. Nobody knows the real cost. Nobody knows the real reimbursement except the monopoly at the top. If we don't build an alternative, private practice will die, guaranteed. Not because it's outdated, but because it's being suffocated. So I built the counterpunch, the BenMaamer Institute model. And I would love to have your feedback, even if you don't want to join, just to make me improve. The model, stay independent, but with power. Here's the core concept. You stay independent, but you share the infrastructure, so your cost collapses and your leverage grows. You don't become an employee, you don't lose autonomy, you don't become badge in the medical factory, you keep your freedom and gain power. More surgeon, lower cost for everyone. This is where the real innovation comes in. You know the Airbnb and Uber lessons that most surgeons don't think like this. Healthcare still function like 1970, 80. Owns everything, manage everything, stress about everything, burnout from everything, and look at the new economy. Uber become massive without owning cars. Airbnb exploded without owning hotels. Why? Because using shared infrastructure beats owning expensive infrastructure. Owning everything, or owning everything outright, it feels traditional. But this is a terrible, terrible business model for surgeons. Owning equal high overhead, high debt, high stress, and low flexibility. Using shared infrastructure equal low overhead, high leverage, high freedom. What the new economy teaches us is simple. You don't win by owning more. This is very important. You win by owning smart and sharing smarter. Don't forget that. That's exactly what this is model does. No administration or administrator torture. Everything you hate, staff, billing, coding, EMR, supplies, HR, payroll, and credentialing, we handle it. You operate, we take the bullets. Let's talk about the money part, and this is very, very important. You'll be 1099 and not W-2. Big difference. You can form your own company, you can structure your income, you can deduct intelligently. You build wealth like business, not like employee. Ask any CPA, and you will be amazed because W-2 is a cage, 1099 is freedom. And because we negotiate supply as a group, your cost drops from day one. This is how you stop being milked from above. Oh, the malpractice, the forgotten thief. Solo equal punished. Big system, discount. But in our model, we will have a group rates because we'll have negotiation power, and eventually, when we grow enough, we will self-insure. That's why malpractice company start sweating. You know what the weapon is transparency. This is the one thing's monopoly fear. Surgeon knowing real reimbursement, patient seeing real pricing, surgeon owned center, eventually a surgeon owned hospital. So total price transparency, and this transparency will destroy the, you remember the $100 Tylenol pill, not box, pill. Transparency makes corruption visible. Transparency gives independence back to surgeon. Transparency restores trust with patient. This is not only about income. It's about fixing US healthcare from inside the machine. You would ask me why Southwest Florida? I would tell you because it's a strategic and lifestyle win. Beaches, sunshine, boating, golfing, and booming population. We have a huge international airport. You are close to everything. Lower stress, higher demand, perfect guide path toward retirement without losing leverage. You work better when your zip code doesn't want to kill you. Huge bonus, no state tax. This is the movement that we are building. A surgeon-led ecosystem, transparent pricing, group leverage, lower overhead, freedom with power, a future physician-owned hospital, independence for surgeons, affordable care for patients. And this is not a club, it's a revolution. If surgeons don't build the alternative, I guarantee you, the monopoly wins. Call me directly. No gatekeepers. Yes, my phone number is 239-481-0033. Accent included, but communication guaranteed. I'm Dr. BenMaamer. This is my fight. This is our movement. This is how we build private practice, one free surgeon at a time. Tell me what you think in the comments below. That will help me improve. And above all, you stay healthy.